Hey everyone, my name is Shamipe, and I'm a first-year medical student at the University of Toronto.
And I'm Arthi. I'm a first-year physician assistant student at the University of Toronto. And in this video, our final video of the series of 4, which ended, even though it was supposed to be 5, we're going to cover a typical day in the life of a PA student versus an MD student, specifically for the first semester at least.
Yeah. We're going to be going through what a typical day, or I guess a more appropriate title would be what a typical week looks like in the life of a med student versus a PA student. What I really like about the program is that no 2 days are alike, and so we have different things happening during each day of the week, and we actually do get a day off, which might be one of the reasons why I may not have chose UT. No, I did choose UT. Anyways, it was a pro on my list of when I was trying to decide which school to go to. So Monday starts off with lectures typically from 9 a.m., run from 9 a.m. to 12 p.m. And if it's a week where we have an assessment, if we have an exam that week, then our assessments are usually 8 a.m. on the Monday, and then lectures start at 9 a.m. So it's pretty much just go, go, go. There's no time to process whether or not that exam went well. You do have the option of attending in person or not. I tend to attend in person because I find that that's better for my learning. Sometimes, some weeks that's possible, other weeks it's not. But the lectures are recorded and you can watch them at a later time in the comfort of your own home. But I find that going to the lectures at the time that the lectures are scheduled helps me keep on top of things. So lectures from 9 a.m. to 12 p.m. on structured topics. And so this week we're still learning about blood because it's the same night that we're filming this. Yeah, and then we have lunch break, and then after that we have our case-based learning in small groups. And so the case for the week gets released. We have a virtual patient who is experiencing X and Y symptoms, and then we have to work through the case, as I explained in one of the earlier videos. So we have that from 1:30 to 3:30. My group typically meets in person, other groups don't. And then my day kind of ends at 4:30, and depending on whether or not there are events happening that evening, I might go to it or might not. Usually I really don't have much doing. I'll probably work out after that. So that's what a Monday looks like for me. What's a Monday look like for you?
I guess it's different. So if you categorize it by the days throughout the week, ours is more it's different for residential block versus online learning. So I'm just going to let you finish up your week, and then I'll talk about those two.
That would be a better transition. On Tuesdays are designated anatomy days, and so our anatomy learning is mainly online and independent. And so typically, for example, I think the first week we're going through the sympathetic nervous system, and so we learned the content or the background information prior. And so the first thing that you do when you get into the lab is you have a quiz, although that might be changing right now, but in first semester you had a short quiz to make sure that you actually did the pre-work, and then you jump right into the dissections. And so even in the lab, you have the modules up in front of you, and you kind of go through it as you're completing the dissection or as you're learning about the bone structures or the prosections, which are just completed dissections done by other people more professionally. So anatomy days, Tuesdays can either be a full anatomy day, so it runs from 9 all the way to 4 p.m., or it can be a half anatomy day where it just ends at 12 p.m. We do get a lunch break, but if we have a half anatomy day, we usually have other events happening on Tuesday afternoon. It varies a lot. You can either have a self-directed learning half day, which means you can study on your own and do other things, or we have our portfolio small groups, which I touched on. And so you travel to your hospital site and you reflect with your group and your preceptor. You can also have your health and community small sessions, so you're either also going to the hospital site and talking about what health looks like in the community, or you're actually going to your placement with your designated healthcare professional worker. And get the drift. What else
Your
could
favorite
happen
day,
on
Wednesday?
Tuesday? Oh yeah, Wednesday comes up. Wednesday is an off day. It's our
AKA
self-directed learning day, which is why I'm here. I'm joking. So it's really to a mess, as we say in UBC. It's up to you what you want to make of that day. That was really nerdy, sorry.
Oh my gosh.
It's Latin for it's up to you. Anyways, moving on. So it's really what you make of it. Last semester I spent a lot of the time sleeping in, and then realizing that I actually did have work to do, and then I had half the day to complete the work. But honestly, we do have so much content to learn, and we have a lot of self-directed learning material that we need to get through, and that day is kind of there to ensure that we have enough time to complete it. You can also set up shadowing opportunities, which I touched on in the last video, or you can really just do whatever you want. Like, it's up to you what you want to do with it. And then
your favorite day.
Yes. And I like it because it gives you a mental break for the week, and it allows me to start.
It's right in the middle of the week too, right?
And I find that I'm able to get through the week with my sanity. On Thursday mornings, we have lectures from 9 a.m. to 12 p.m. usually, and the lecture content can vary. So right now we're doing our Health into Science research lecture series. We're also going to have an extra scientific lecture this week, actually. Earlier in the semester, in the first semester, we actually had our lecture series on ethics, as I also mentioned in an earlier video. And then in the afternoon on Thursdays, you travel to your hospital site. Depending on how far it is, you have to take transportation. Some people are lucky enough to walk across the street. Others, like me, are placed at a farther institution, or hospital, sorry. And so we take the shuttle. It's actually nice. We all kind of get to bond, and it's a nice ride, I guess. And then we get to the hospital site, and this is where we review the case-based learning material with our facilitator.
I'm so tired.
And so our preceptor is there. We walk through the answers that we sent them on the Monday or Wednesday night for your independent questions, and then he walks through it and tells you where you went wrong, or if you missed something, and then that typically ends at 4:30. Now we're at Friday, our favorite day, kind of. So Friday for me, I have to wake up at 6 a.m. because I chose to stupidly live far away from campus.
Are you over
I kid, no. Anyways, I don't live really close to campus, so I gotta wake up early, get to campus, take the shuttle, and then the shuttle takes me to my hospital site. But Fridays are for clinical skills. A lot of it in first semester was learning how to take patient history, and then later on we learned how to take the vital signs and more of the physical examination part of things, and that ends at 12 p.m. And Friday afternoon varies, so some weeks we have again our self-directed study block, and then if we have an assessment coming up on the Monday, we'll usually have an integrated summary lecture, which is just an opportunity to consolidate all the material that we've learned so far and to ask the lecturers questions. And sometimes the lectures have a twist, so we can have a panel, and sometimes the panel is with physicians who are actually doing the groundwork of what we've been learning in class, or it can be a patient panel, which I love the physician panel, but I actually really enjoy the patient panel because you get patients who tell their personal stories, and it really helps to consolidate the material and to kind of not just learn it in like a book related, like it's not a book, but like a personal from the patient who's actually dealing with that, and it helps the material stick. And so that's really and when we do have things in after clinical skills on the afternoon on Friday, the day ends at 3:30 or 4, and then the weekend is yours or not because you're studying. But
because usually assessments are on Monday, right?
Yeah, for us. Yeah.
It's the same for us too. Like usually it's on Mondays, except for the last clinical skills exam, which was on a Wednesday. But yeah, so typical day in the life of a PA, I guess it varies if it's during residential block or during the online learning, distance learning, whatever it's called, the different names. So residential block, it is more structured in that the program director, like the whole program kind of schedules different things, and then you have like the Google Calendar where you can see what your schedule's like. I am fading. So yeah, it could be a variety of things. So it's mostly focused on clinical skills and the hands-on skills, and you have a facilitator who provides feedback while teaching you stuff. So vital signs is what we started off with. They teach it to you, and then you kind of do it on like a partner. Or if you're seeing SPs, which are standardized patients, the facilitator kind of sees you kind of do the whole medical history or physical examination, and then you get feedback from the facilitator as well as the SP. So that's always nice. And then that could be a portion of it, so that could be in the morning or that could be like in the afternoon. And then other aspects or other things that happen during res block could be like a whole like reflective seminar, so like how has it been going, or they check in with you, the program director checks in with you. Usually it's with a pizza lunch. And then there's another pizza lunch where we talk about like intro to like future courses, or like clinical placements, like securing clinical placements and how that kind of works. Clearly I'm focused on the pizza because I'm picking up other pizza lunches, but so it could be, it's usually like, Res Block is, since it was like, at least for first semester, since it was at the beginning and the end, it was to kind of introduce you to a course or kind of wrap up a course. So that was always good. The distance education or the online learning aspect of it is more self-directed in that your Wednesday is basically our whole week. So it's up to you to do whatever you want with it. Probably study because you probably have an exam, like it's very frequent. Very
is what
frequent.
she meant to say. Yeah.
Yes, thank you. I'm awake. Okay, it's very frequent, so it happens, I guess it's more often this semester, but you kind of have to, at least what I do is like every month I kind of see what examinations or exams I have coming up. I try to look at the semester as a whole before and schedule my LCs accordingly and then confirm closer to the time, but then every Sunday I kind of look at my calendar and schedule what I need to do for each course across the different days, and also schedule my workouts or hangout sessions and stuff like that. Hangout sessions, wow. And there, so like that's how my days kind of go. So this semester, last semester I kind of worked from AM to PM, which was not the smartest idea, and probably more prone to or more susceptible to burnout. By the end of the semester I kind of felt it, but this semester I'm trying to take a different approach and do like a work day kind of schedule. So I work from 8:30 to 5:30, and then the evening's kind of up to me to do whatever, or if I'm working out in the morning then I kind of push it back a bit and then work till like 7 p.m. or something. But hopefully that gives me more of a balance, but there is less of a structure with online learning. And I think that's part of the reason why you need to kind of assess the programs you're going into, because you need a lot of self-discipline and like be able to have independent learning and be okay with social isolation when you choose these kind of programs. But yeah.
Similar to that, I think that there's a lot of things that you mentioned that I will take away and try to incorporate into my own life.
Wow.
So I like to think I'm an early riser, but I'm really not.
No, you're not.
But I find
mornings are the best.
But I find that when I do wake up in the morning and I'm productive, it feels good and I feel less groggy, and like I didn't waste my day as much. But that only works for me if I have a good sleep schedule, and so I need to sleep early if I'm gonna wake up early, and that's something that I guess my parents didn't really emphasize when I was growing up. So like we always slept pretty late at home, and so I've gotten used to it. But it's something that I'm definitely working on this semester, and also wrapping up like social activities for us and Med, because we have Wednesdays off. Tuesday nights are the new Friday nights. So like social events tend to happen on Tuesday nights, and like it's really nice that we do have that dynamic in the class where we do actually do things together outside of school, and we can stress relief. And so like that, sometimes I don't go to all the like social events, but I go to like things with smaller groups of friends, like going to the movies or going to dinner, and I find that really helps. And also living with my sister, I get to do things with her as well. But this semester I'm going to try and incorporate other activities, and so pursuing things that I actually enjoy, and like kind of as I touched on, and I think we touched on it in the last video, having some sort of balance. And so I find that when I do things outside of school, I'm better able to perform in school and focus in school, because I feel like I've had that break.
Very true.
And that's like, you just have to find what works for you. And for me, like sometimes, like when I do feel like I need to rest, then I will take half a day and sleep in and watch Netflix, because that for me is self-care. But self-care to me is also going for a run, and it's also taking the time to read a book, or taking the time to talk to my mom and dad via FaceTime, they love it, or like talk to my sister or hang out with this one. So whatever works for you, please try to incorporate that into your life, because med school and this journey for PA school as well is really intense, and it's really long. Well, for me it's really long. So it needs to be sustainable. I need to have a sustainable way to deal with it. But yeah, I think that's pretty much my spiel, and I'm pretty sure that I've missed things or left things out that I wanted to talk about, but I'll be writing a blog series on transitioning into med school, so I'll probably I'll probably elaborate on a lot more things in those blog posts. But I hope that this kind of helped. And I know that you're tired of listening to us talk, and if you're still here, thanks again
for your patience.
But
I think this is the last final video of this series. Again, yes, we were wearing the same outfit, but it was all done in one night, and I hope the quality of this video is up to your standards. But I hope honestly, I hope we helped you guys kind of get better insight into how our programs are like, our application process, as well as what our first semester is like.
Yeah.
And again, if you have any questions at all, feel free to reach out to us. We will try our best to answer your questions, as well as if it's a common question, we'll try to do another collab if possible. But we hope you guys enjoyed it, and can't say stay tuned.
Yeah, well, but this completes this series. But in the future, we will most likely be doing some more collaborations.
Promises.
Maybe not. But I think that we will try maybe on other topics. But we hope that you guys have enjoyed this. Thanks for tuning in.
And good luck with your journey.
And if you're just watching these videos out of curiosity and you're not on either path, also thanks for tuning in. We really do appreciate it.
We're rambling now. The circle thing about interviews. Okay, bye.
Bye.